Assalamu alaikum, everyone, and welcome to the latest session from Darul Noor on the Health and Wellness Committee. I hope and pray you all are well, keeping safe and keeping positive. As you all know, that the things are really uncertain these days, and we all are really looking forward to go back to normal. But today I read like a really good saying by somebody that we all want to rush back to normal, but for most of us, we don't know what normal is, and we have like this is a good time to consider which part of normal we want to rush back to. Before our session, we were supposed to have Dr. Hina Khan with us today on the latest development and latest updates on COVID-19, but she's at work and hopefully will be able to join me at the end. We have our presenter, Tabassum Rahman. She's a clinical social worker, and she will go over some techniques and some advice on parenting during this time. This is the Tabassum. The mic is on to you, and I'm starting the presentation as well.
Sounds good. Assalamu alaikum, everybody. Thank you so much for having me. My name is Tabassum Rahman. I'm a licensed clinical social worker. I am also part-time therapist at Darul Noor for the past, I believe, 7 or 8 years. So if anyone ever needs an appointment, please feel free to call Taliba and set one up. And I just wanted to go over some challenges that we are having during this time in parenting our children. Although it's a very difficult time, we really should look at the wealth of opportunities that this brings us. Finally, we have one-on-one time with our children at home, whether they're young or they're a little bit older. Kids are coming back from universities too. So if we could just get the presentation started. I have a couple of slides to go through, but I can also talk through with them, and here they are. So before we get into the specifics of how to parent during COVID-19, let's start off by really going over some of the important things to improve your relationship with your children. If we have a good foundation, then inshallah we can build upon it. So we'll just go over the 3 C's to improving your relationship with your child. So Sister Asma, if we can go to the next slide. Now, the first C to remember is care. Care is meeting the needs of your children. Now, of course, the basic needs are, having a roof over their head, clothes to wear, and food to eat. But there's also other needs that children have. The biggest need is for them to have opportunities to express themselves. They can express themselves emotionally, artistically, spiritually. Those are some of the things that we need to address. We also need to keep our children safe. That is above all everything that we need to do. So although we can give them some ability and some room to do things, we also need to look at their safety. Another way to share concern or, show care for your kids is to keep all your promises. Now, parents are challenged by this because you want to, on one hand, give your kids an incentive so they have something to look forward to do what they need to do. Like, if you clean up your room the entire week, we will be going to Chuck E. Cheese on Saturday. But you have to remember, from a child's perspective, they don't really have a good sense of what time is. So although you think it's a couple of days, to them it might seem forever. So my advice to parents is just to keep those incentives secret or hidden, or just in case you aren't able to go. Like, what if COVID-19 came and suddenly we can't go to Chuck E. Cheese? The kids won't really understand that. They said, but you promised. And it's really hard for them to understand. So just keep things like that till the end. It's even better, to have like a last minute spur of the moment, surprise to go to. So that's one way to be able to keep all your promises, is by kind of really sharing them towards the end. And then another way to show care for your children is just show lots of love, verbal and nonverbal. Hug your children, kiss your children, spend a lot of time with them, praise them. You really can't spoil children. You can't spoil them by just going ahead and just reviewing the basics of what they did. You could say little things like, I really like the way you cleaned your room. By pointing out facts, it's really hard to spoil children. And then now we're ready for the next slide, which is communication. Taking a team approach, work with your children. Communication is really a great foundation for earning respect. And you can earn your children's respect by showing them respect too. This doesn't mean that, you have to bow down to them or let them rule you or, let them tell you what to do, but just keep an open dialogue going with them. Kids sometimes, like us, get frustrated and don't know what's going on. And sometimes they may speak words that aren't the best. But when your kids are going ahead and maybe having meltdowns or really getting frustrated, listen for the thoughts and feelings that are coming through with them, and then ask for clarification. Say, you said you're really angry. What does that mean for you? Why are you angry? What makes you angry? What could I do to help you so you don't get frustrated? And, just asking children questions will go a long way. And have clear expectations and consequences for them. I love this. A lot of parents come to me and they're like, I asked her to clean her room, but she didn't. And the kid is like, but I did clean my room. The link over there was the expectations were very different. So although this might take a little bit of work, I've often given parents some homework. I'm like, you know what? Clean their room the way you'd like it. Take pictures and then have a checklist. What does a clean room mean? Does that mean that everything is off the floor? Does that mean that the wastebasket is empty? Once you have set clear expectation for your children, then only can you discuss the consequences and be very firm about the consequences too. Like, no media for a week. Well, what does that mean? Is that TV? Is that gaming? Is that Facebook? But what if they need to use the internet to do a project? So you really have to kind of think about it too. And, for us as parents, we kind of have to sit down and kind of think, what kind of expectations do we want to have for our children? And what kind of consequences do we want to give them? And remember, the consequences shouldn't be punitive. They should not be shaming. They should not make the children feel bad. They should be more like real world consequences, like suppose we don't get to work, we don't get paid. It should really kind of teach them about how to function in the adult world. Remember to stay firm with your communication. Once you've sat down and had the expectation, the consequences, you have to kind of stay firm with your plan. Let them know that you're serious and that you've thought about it and you're going to give it a try. Also, be flexible though. If it's just not working for you or the children, then within a week or two, be open to having a family meeting and maybe revisiting the situation and trying to develop something different. And most importantly, keep a 5-to-1 minimum and maximum. The best is the 20-to-1 ratio of criticisms and then positives. So you have to praise them at least 5 times for every one critique that you have. And the best scenario is to go ahead and praise somebody 20 times before you do one critique. And this is something that you could even take into your personal lives. So it's not just with parenting, but something that you can use with coworkers, loved ones. It really goes a long way to really let somebody know that they're respected in the first place. And then the last, see if we can go to the next slide, is concern. Go ahead and kind of take stock. What is important to your child or for your child? What do you want for them? Imagine their lives. Imagine them growing up. What kind of career do you see them having? What kind of spiritual practices do you want them to have in place? And then take that knowledge and then try to go back and build up steps that build that foundation, that base for them. And with concern, empathize with them. It's not easy being a 2-year-old and not getting what you want. And it's not easy being a 16-year-old and not being able to go out and meet with your friends and, do the things that other children do at this time. So this is a trying time for the kids too. And the way you'll be able to do that is by spending more time with them. Kind of see how they feel. I mean, are there some times in the day that they may be feeling low? And try to understand how they may think or feel depending on their psychological development too. Telling a 3-year-old not to do something may be a little difficult, but explaining it to a 14-year-old may be a little bit easier. So praise them for being and doing, but don't ever mix the two. Now, that's a little tricky, but it's not that bad. In order to increase the self worth of your children, you have to just praise them for doing things. And then also, just praise the child for who she is or he is. You give the message to your children that you only love and appreciate them when they do something, then that's conditional love. And what we were trying to work for is what we want to do is give our kids unconditional love. We want to let them know that no matter what they do, we still love them. We may not like what they're doing and we'll help them to get to a better place, but they are perfect just the way they are. And this is a great time to build positive memories. I mean, social media, it's so great. So many people are doing different things with their children. This is the time that you can even plant a garden, take a walk. But really, the best thing to do to build positive memories with your children is share stories. I mean, how many times have you told them about little things that happened in your childhood or little examples of trials and tribulations you have? When was the first time you fell off a bike? How fun was it for you to fly a kite for the first time? What was your favorite book growing up? What was your favorite color? These are a lot of things that, in daily life, in the hustle and bustle, we never really get to dig deep. And this is the time you might want to pull out your favorite game. May it be Scrabble or Connect Four or Ludo or Parcheesi, and, kind of share something about yourself with your children. This is a great time to bond. So, how does all this translate into parenting during COVID-19? If we go to the next slide, here are some considerations. First of all, the children really need you to be, as a parent, their rock, their foundation. They need to look up to the people that are in charge, that are going to help and protect them. And that's where they're going to get everything from. So check in with yourself. And I know the news can be really disturbing, and we're all kind of having this heightened anxiety sometimes. It's a lot for some people, it's less for others, and it ebbs and flows, and sometimes it goes up and sometimes it goes down. But make sure that you're centered, grounded, mindful when you are really interacting with your children. And if the kids come up to you at a time and you're stressed, it's perfectly okay to let them know, what, let me get back to you in 10 minutes. Now, do follow up later. But if you are in a place where you feel like you really can't talk to your children and be the best person for them to depend on, then give yourself some time and just check in with them later. And then the one great way, and I know, Dr. Hina Rahman will probably come on and share some of the other developments that we are finding out from COVID-19, because this is an evolving pandemic. Get your facts straight. The Center for Disease Control, cdc.gov, is constantly updating their website with the newest information that they have. And then when you talk to your children, talk to them at their age level. Ask questions. Um, you can start off the conversation by asking your child, so what questions do you have? They may just want to know when school's open again. They just may want to know, the ice cream that was out of stock, will that ever be restocked? Kids can be very simple at times. And so you really need to kind of stop and ask them what they're concerned about, and then also respond according to their age level. Maybe they don't need to know that this pandemic will settle down in 7 or 8 months and we'll be able to be doing spring break next year. Maybe that's too much for them to grasp. So really ask what the kids want to know, and then just answer them with the bare minimum that they need to appease themselves. And help your child take control and help themselves. Teach them about washing. Tell them that, the best way to prevent this disease is by covering our mouth, not touching our face, or washing our hands. That can be a great family activity, because we're running out of ideas every day to keep the kids busy. But have a family hand washing session. How do you wash your hands? Put the timer on and let them know how to dig underneath their fingernails, in between their fingers, that can also be a great activity to have. And that all goes into trying to stick to the regular family routine. If you had pizza night on Friday, then go ahead and continue to do that. If you don't want to order pizza from outside, this is a time to make your own dough, make your own pizza at home. If you guys always, used to pray Maghrib together in Jama'ah at home, this is maybe the time to go ahead and do that. Or if you guys, because of different activities, never got a chance to do dinner at the same time, this may also be a nice time for you to establish a regular family routine. You might like it so much that it might be something that you would continue after everything is over. Maybe it could become a part of your new normal. So use this opportunity to really enhance those bonding experiences. Share your stories about your childhood, create new memories with them. And then most importantly, keep calm and carry on. Be the calming and reassuring presence in your child's life. When children get a little bit stressed, don't be alarmed if they may, regress back to some habits. Maybe they want to cuddle with you in bed. Maybe they want to be around you a little bit more. Maybe they just need that reassurance from you and that calming presence. So I hope these tips were helpful. And please, if you have any questions, direct them to Sister Esma and the wellness community, and we will try to address them as best as possible. If there are any special parenting concerns or considerations or other topics you'd like me to cover, please let me know. And inshallah, I'll do my best to respond to that.
Thank you, Sister Tabassum, for the valuable information. It was really nice having you over. Thank you so much for taking time out for your busy schedule and giving us this presentation. I hope it will be beneficial for all of us who watch. So I see Sister Talba logged in now. Sister Talba is my team member. She's the board member and also a social work. She is the for the interfaith. She is the chair for the interfaith services, and she's very active with the social welfare department of Darun Noor as well. She will have a message, but before that, since Hina was able to join us from her work, and she will give us the latest update on the latest development of COVID-19. So Hina, go ahead.
Assalamu alaikum, everyone. I'm Dr. Hina Khan, and this is our third session this week that we've been doing. So just a few updates that I had for you all. For the COVID-19 cases, as of this morning in Virginia, there have been more than 3,600 cases. And unfortunately, 75 people have passed away from that. In our own Prince William County, we've had 236 cases. We've had 4 deaths. But good news is a lot of people are recovering from it as well. So clearly the virus has a community spread, and we're still asking everyone to do the social distancing and keeping at home. The 2 things that I really wanted to talk about real quick was the first one was about face masks. I know we had discussed this the last time as well, but I think there's still some questions about it that have come through, and people want to know what is helpful for them. So I know with all the new recommendations in place where they're saying you can wear a face mask out in public, you should. If you're going grocery shopping, anywhere from like a scarf or a homemade one is good. What I really want to point out is that face masks, whether they are a homemade mask or whether it's a scarf that you've wrapped around or a surgical mask, they will provide only some protection. Even the N95 mask that I see some people who are wearing around at grocery stores, if they're not, they only work properly if they have been, you have been fitted for them. So there's a whole test that we do to make sure that they fit you well in order for them to be effective. So any mask that you're wearing, just want to let you know, yes, it does help a little bit in decreasing the transmission, but it's not completely foolproof. Your eyes are exposed, your hands and clothes are exposed. And if you don't take off the mask properly, you can still touch your face and nose. You still can get the infections. The best thing to do right now is to still stay put at home. Do not have any family or friends over. Do frequent hand washing. Don't touch your face. And when you do go out, you're wearing the face mask, great. But even at other stores, limit your grocery store shopping, and then make sure you have a 6-foot distance from all other people, and then that you're washing your hands pretty well after you return from a visit outside. The other thing was, the question was, can COVID-19 virus spread through food, including restaurant takeouts and frozen food packages, etc.? So the main spread of COVID-19 is from person to person. Currently, there is no evidence that is transmitted through the food, okay? But it is possible that a person can get infected by touching a surface or an object. For example, a pizza box that, you know, you're getting the pizza delivery in. So supposing the pizza is good inside, but if somebody who has COVID-19 has touched it or sneezed upon it, then if you touch that box and then touch your nose or mouth, then you can technically get infected. But this risk is still very, very low. Studies in the New England Journal of Medicine, and that was just published on the 17th of last month, they have shown that the virus can survive on cardboard boxes for around 24 hours and metal and plastic surfaces for a good 2 to 3 days. So the best thing to do is to wash your hands very thoroughly. So and I'm not trying to put the pizza industry under the line, but supposing if you're getting pizza, you open the box, you wash your hands, you transfer the pizza to your plates, you throw away the box, you clean all the surfaces that box has come in contact with, supposing your kitchen counter, and then the door handle that you might have used to open your garage door. Then you wash your hands thoroughly for a good 20 seconds, and then you enjoy your pizza. So, you know, we're still in the thick of things. We're still expecting the peak to happen somewhere late April to mid-May. So we're going to see an increased number of cases, but the best thing for you to do is to be super cautious and make sure you protect yourself and your family, and hopefully we'll see a downward trend of this virus in the upcoming months. And that's all I have for today, Sister Asma, if you wanted to take over.
Yes. Thank you so much, Hina. Thank you for joining me. I understand that this is a really busy time for your clinic and you've been working like really long hours, but thank you for the updates. And I hope everyone who's getting the updates will follow them and will benefit from them.
All right, thanks.
So up next, we have Sister Taliba. She is a board member and she will share some updates on social services from Darul Noor.
Bismillahirrahmanirrahim. Assalamu alaikum, my brothers and sisters. I hope Tabasum's message to you was informative, and please think about what she said today. I'd like to just mention that when I was a child, polio was the virus that was the pandemic and concern. At the time I was a toddler, all the way into kindergarten. Kindergarten, by that time they had gotten a vaccine. And so they lined our classes up in the cafeteria, and the health nurse, the public health nurse, would give us the shot. And this went throughout the city. All of school kids had to get the polio vaccine. I felt safe. I was never insecure. I was at peace because of how my parents spoke to me. So I hope you took what Tabassum said today and practice some of her ideas and suggestions, because my parents, I felt safe, secure, at peace because my parents talked to us appropriately for our ages. If they had any fears, the two of them spoke in private. They did not share their fears with us, the children. So please take this to heart, to speak to your children appropriately, and use the suggestions that Tabassum has given you. If you as an adult would like to talk to another adult, currently from 12 to 4 every day except Friday, you can call the masjid 703 580-0808, press 1. And Imam Jamal or Imam Abdul Ahad pick up the phone, and you can talk with them any concerns that you might have. If they don't answer, just leave a message with your name and number. Within 24 hours, one of them will call you back. When we do open back up, if you feel you need to have a face-to-face with Sister Tabasa, again, the number would be 703-580-0808. This time, press 4 for the counseling. Leave your name and your number. And I'm the scheduler. I will call you back within 24 hours and schedule an appointment. She's at Darul Noor once we open back up on a part-time basis, and it's by appointment. Right? So, on a daily basis, 12 to 4, you can talk to one of the imams, 703-580-0808, press 1, or press 4 if you would like eventually to schedule an appointment, Sister Tabasa. And I also like to let you know that every second and fourth Sundays from 10 to 12 noon out in the parking lot, we will have our food rescue program. So if you are this coming Sunday from 10 a.m. to 1, and we will be distributing.
Thank you, Sister Talba. Thank you, Dr. Hina. Thank you, everyone, for watching. As always, for any questions, please email us at health-wellness@darulnoor.org. We are here to help you. So any feedback, any questions, please address it to the email health-wellness@darulnoor.org. Stay positive, stay safe, and inshallah, we'll see you next week, same time, on same time, same place, inshallah. Take care and assalamu alaikum.